Hi, everybody. I'm Erika Sanzi, the Director of Outreach here at Parents Defending Education. Welcome and thank you for tuning in. Today, we are going to talk about a subject that is increasingly important and also quite shocking to most people. We at Parents Defending Education recently broke a story about emails obtained from the Seattle Public Schools in Washington State showing that school-based health centers in the Seattle Public Schools will be offering what is often called gender-affirming care. And that would include not only puberty blockers, but also hormone therapy, again, to children in a school-based health center. Since then, we've gotten many comments and questions from parents about this concept of school-based health centers. Many parents, including myself, thought that these centers were really about making sports physicals easier, making it easy and quick for students to get swabbed for strep throat, making it easy for students to have their teeth checked. And instead now what we're seeing is documented proof that a part of the plan of these school-based health centers does include a menu of puberty blockers and cross-sex hormones for children, again, on their school campus. We thought it would be really helpful to break down for all of you what are these health centers, and also talk to some experts and people who have a lot of knowledge about what exactly is going on in K-12 schools as it relates to the health centers. So we have two very knowledgeable guests, one of whom is an actual guest. She does not work for PDE. Her name is Carrie Mendoza. She's an emergency medical physician and the director of Genspect USA. Most importantly, she is a mom. And what she and I share in common is that we are both mothers of 3 sons. Rhyen Staley, he's an in-house guest. He is a researcher for us at Parents Defending Education. And he is the one who has contributed and compiled this investigative report on school-based health centers. He is also a dad of 2. Thank you guys for joining me.
Thanks, Erika.
Thank you, Erika. What a pleasure. I love what you all do. So thanks for having me.
Yeah, I'm really happy to have you here. This is an extremely important conversation, and I think we can all agree on that. Okay, so Rhyen, I'm going to start with you because you have really been knee-deep in researching this. So again, when people hear the term school-based health center, what is that? What services do they typically offer?
The school-based health centers are often they're administered by local hospitals or local clinics, health clinics, put inside the school. So a facility of some sort. Think beyond just your nurse's office. And they're going to offer a range of services to the students that go beyond just like, Band-Aids, et cetera. They go from behavioral health to dental health, emergency contraception, immunizations and vaccinations. And then they go all the way up to reproductive health care, and even, as we're finding out, gender affirming care. And so these students have access to these facilities throughout the school day, at their ranging from elementary all the way up to high school.
Okay, Dr. Mendoza, do you have anything to add to that?
I think that, first of all, the investigative work is fantastic you've done, and I think it just shows an evolution of the idea of having some services that make it more convenient for families, especially as there's more working parents, and how that is morphed into basically a medical center at your school, which I think, if people step back and they say, well, wait, that's not really the function of school. And there's just a lot of questions that obviously go into who's there, what quality is going on there. And this scope of services just doesn't seem to be something that is, appropriate for a school.
Yeah. One of the reasons that we put together this report is because of how young the age of medical consent is in some places. And this is a really important point for everybody to understand. You can't just pull up or quickly Google age of medical consent, because what we have learned in trying to do exactly that is that it really does vary based on the services. And oftentimes it's the services related to sexual health and gender and mental health where we see the lowest ages. So, and again, when I say young, I mean 12. So we're talking about sixth and seventh graders who in some states can get health care without the knowledge of their parents. Theoretically, a middle schooler can consent to what is truly life-changing medical treatments at a school-based health center. So Dr. Mendoza, can you give us an example of what could potentially happen in a scenario like this with a young child, in this case now a student, accessing care at a school-based health center?
Sure. Well, as you mentioned, this idea of consent is really important to understand when we are talking about what's going on in examples. Normally we are used to, you go to the hospital, you go to the doctor's office, and, if you have a child, if they're under 18, you as the parent have to sign the consent forms. But people might be more and more familiar, especially with electronic health records, that they're finding that it's actually 12 years old, that there's separate consent or parts of the electronic health record are blocked from the parents unless your child is down to 12 years old consents. And that has really come about because back in 1977, the Supreme Court ruled on a case that was basically affirming that a 12-year-old, down to 12 years old, minors have the right to privacy for to get contraceptives and to not let their parents know. And so that, back 30, 40 years now is laid a highway out that a lot of sexual health matters have been grafted onto in terms of this down to 12 years old marker. And so an example would be, if your child in middle school, wanted to get contraception and there's a school-based health clinic, the law in that particular state may very well at least say, at 12 years old and up, they don't have to inform the parents. The child can just go in. There are some nuances in different states, as you were mentioning, even in the contraceptive issue. But basically, the foundation of this was laid in 1977. And so, we'll talk more with, hormones for gender dysphoria, but that has been grafted on to this foundation that, down to 12 years old, if it's in this umbrella of sexual matters, sexual health, there doesn't have to be parental consent.
Yeah, and also what I've noticed is that in some states, like California and Vermont, and I know there are others, it's not even just the sexual health umbrella, it's also now the mental health umbrella. So they are actively treating under that sexual health umbrella, but also mental health treatments potentially now on campus without the knowledge of their parents. Rhyen, what else do you feel like parents really need to know about this subject?
Well, if I would give you an example about Evanston, Illinois, where the through documents and news reports, actually, it was out in the open. Students and their parents were required to sign a one-time consent form that gave general care access, but then the school was handing out contraception, including the emergency contraception for students. And then even one of the nurses a couple of years ago had made a comment that when students needed abortion care, they were assisting the students in getting off-campus abortion care. And so you see that the nurses inside these facilities and staff members will utilize the system. The parents give this consent, and then the parents don't know what's going on because, like we were discussing, in some states they don't have to inform the parent of access to these sexual health, reproductive health care type situations.
Erika, could I just add in just on that point that
Sure.
he gave in the example with Evanston? I think it just is back to the, your initial opening in the conversation of basically like these mini medical centers in schools, but they're not, because they're not actually in medical facilities, they're actually not following the norms that we do in a medical facility. When you come to the hospital, every time you come to the hospital, even if you signed a consent the day before because you were in the ER, you have to sign a fresh consent for that encounter. It's the same when you go to the doctor's office. So this idea of consent's important, but I think it's important to understand that they're not following the norms we do actually in healthcare. Every time a child would have to sign a fresh consent, an idea of a one-time consent to cover everything for the whole entire year. I mean, for field trips, you have to sign a separate form every time they go on a field trip. So, I mean, I think that's just a super important example for people to understand.
Wow. So yeah, so if parents find themselves being asked to sign a general consent related to a treatment at school or a school-based health center or something early in the year, to be aware that they could be signing a lot that they're not aware of with that early, overloaded with paperwork, 1,000 signatures needed at the start of the school year. That's a really good point. I'm glad that you said that. All right. So proponents of school-based health centers, and I might put myself in that camp until recently because I clearly had a vital misunderstanding of what they were. They often criticize, anyone who is skeptical or critical or not comfortable with the concept by saying things like, oh, well, what, you don't think that poor children should have their hearing checked? You don't think that poor children should be able to get their teeth examined? You don't think that poor children deserve, basic health care? Perhaps you guys have already heard those claims. I certainly have. And I think that also, like, all parents will draw the line in different places about what they think is appropriate and is not appropriate, in a school setting and related to healthcare for their own children. But it does seem like a lot of parents are drawing this line when it comes to sexual health, gender-related health/topics, and also mental health or psychiatric treatment. So, Dr. Mendoza, in your opinion, and I'm asking you this as a physician and as a mother, do you think that school-based health centers need to be removed altogether? Or is it your thought, like should these just be total, like this is a no-go, like non-negotiable? Or do you think that there's nuance to this and that they can and should serve a function, but that they've just sort of lost the plot?
Yeah, I think that just common sense. I think there's, of course, nuance, like in any of these other topics we talk about with parents and educational issues. I think, trust but verify, right? I mean, red flags are when you're being ostracized, demonized, or shamed for asking clarification information. That's a red flag. So I just think that, if the scope of practice has been so expanded and that there isn't clarity as to how to put up those guardrails that are up to the parent to decide, then I think that particular school-based health center, would be concerning that they're not respecting, parents' rights and not practicing safely. I do think, as you mentioned, there are different needs in different economic areas. Again, I practice emergency medicine, so just by nature, we deal with folks who may not have access to care, and they use the ER because that's, open 24/7. And so I have a very good handle on, in my area, in the south areas of Chicago, a lot of services that are available that aren't just, in the school. So my point is that it's a nuanced topic. There can be a lot of services outside the school that are available. There can be services that may be being executed properly, but there may be other ones that aren't. And so I think, again, a parent, should be able to ask questions. I think advocacy groups should be able to ask questions. And if that is taken in a political way, I think that's a huge, huge red flag.
You just made me think of something that I really did want to hit on. So it used to be that everybody who worked in education and sort of other social services or whatever, like there was this understanding that parents that were negligent, abusive, cruel, they existed for sure, but they were the outlier, right? We didn't treat them as the default. One thing that I've noticed coming, unfortunately, coming from the K-12 sector for sure, is this new habit of sort of taking the worst case scenario and now making that the default, right? So that if a parent asks a question, doesn't agree with something, doesn't share the same politics as the school, that words like dangerous, harmful, and unsafe are being used to describe those parents. Do you have thoughts? Have you seen the same thing, I guess, is my first question. And do you have thoughts on that?
I mean, I think we're all of us, again, who are working in the space in terms of, advocacy, have seen this sort of environment of demonizing, parents without even like knowing them, without even, understanding what their issues are. And I think that is, very, very, a dangerous situation. There's a case, I think it's out of Maryland, about a young woman, Sage, who was in the high school environment, and basically the staff, was assuming that it was the family that was the problem. And this youngster ended up in social services, ended up being trafficked. And of course, the parents weren't the problem. So, I mean, that's an example. I just think that, parents feel, can get to feel uncomfortable to express their concerns. But I think that, if you're armed with the proper information and your rights and the laws, you shouldn't be. But I mean, to your point, I feel that the school environment very much can be just assuming parents or guardians are bad faith actors when there's no evidence for that.
Yeah. And just a reminder too, for everybody watching, everybody who works in the school is a mandatory reporter. So if they have true suspicions or believe that based on what they're seeing, that parents are dangerous to children, they have a legal obligation to report that. And so what we see instead is a lot of people throwing around words like unsafe and harmful and dangerous, but they're not contacting any authorities despite their responsibility to, because I think really it's a little bit more of like I don't agree with this person. They don't share my worldview, my opinion on this. I'm going to call them all these terrible things. But again, if they really believed that, they would, again, be obligated to contact the authorities. And we're not seeing that happening.
And also, Erika, just to add on quickly to that goes to the same for physicians and medical staff. I'm a mandated reporter. So if there's something in the emergency department and there's concern for elder abuse or child abuse, we are mandated to call social services. And so when you're having, again, sort of mini medical centers inside schools, you have to remember that the medical staff are mandated reporters. I think what we've seen, though, what is concerning is that if they are reporting it in the reverse way, right, where because a parent, might not agree, with a certain political stance that has basically been taken as gospel in schools, that can be flipped, the other way on parents. But yes, mandated reporting is important to understand.
Rhyen, so it seems like these school-based health centers that treat or refer for things related to sexual health and gender, they kind of seem like they've popped up all of a sudden. Maybe that's not true, because it also could just be that the awareness is breaking through. But who is behind this push where, we feel like we never heard about school-based health centers? I remember hearing about them like they were like people had this dream that someday we would have them. So now here we are. Again, where is this coming from?
A lot of different places. So one of them is the federal government. This current administration has been pushing hard on implementing these. We profile one of the groups, federal groups inside of our report. The other is teachers unions, who, believe it or not, the American Federation of Teachers, the AFT, has a few union memberships through nurses organizations. So the teachers unions can also benefit. You have nonprofits. There are a few nonprofits that are really pushing this hard for various reasons. But then you have Planned Parenthood. And believe it or not, in Los Angeles County in California, Planned Parenthood has a contract or a memorandum of understanding with the county that administers to school districts, including LA Unified, Los Angeles Unified, and other school districts, to put in what they call wellness or well-being clinics inside these schools. So you also have Planned Parenthood administering these clinics inside of K-12 schools across the Los Angeles County area.
Okay. And Dr. Mendoza, who are you seeing leading the charge for this in your area, which is Chicago?
I think, Rhyen gave a great description, I think, of the folks. Obviously, the federal government is huge in healthcare policy. We see that in general, even though there are obviously state level, controls. But also, if you're in a region with, a large, well-funded children's hospital, like we have, Lurie Children's Hospital here, and then Hope Children's Hospital on the south side of Chicago. I mean, we've got like 6 or 7 major medical centers in the Chicago area, but, the big children's hospitals can also be, partners in this too. And again, I think, like a lot of things we see in this space, not just the medical, things can start out with certainly good intentions, right? Like we all know, if there's, lower income areas in LA or in Chicago where I am, and it seems to kind of all make sense. But I think that we all understand too that this is a highly successful business model if your worldview is that the federal government and sort of big, NGOs have a role to play in something like healthcare. And a lot of things in healthcare have been scaled up, including, hormone treatments for minors have been scaled up because of the reach of the federal government basically saying, hey, we won't give you, financing or reimbursements for, the CHIP program or Medicaid unless you include XYZ services, or you do X, Y, and Z. And so there's those, we see that in just general education issues. But yeah, so I think in addition to what Rhyen said, I think the big children's hospitals also have a role.
Yeah, and we've certainly seen through our work at Parents Defending Education, lots of partnerships between school districts with the children's hospitals in their area as it relates to gender. So we see lots of trainings for teachers and for staff, and other ways that, again, it really does. It feels like an ideology is coming into the schools by way of the hospitals, which is sort of shocking when you first see it and you see the documents yourself. But unfortunately, that just is the reality right now, that along with all of the wonderful, amazing, and important and even miraculous things that children's hospitals do for children, there is this piece around gender that is quite concerning. Okay. I think that we all would agree that there's a mental health problem going on with kids. There's a lot of talk right now about the pandemic and how it has caused that. There's obviously a ton of talk about technology, cell phones, smartphones, social media, etc., that is also wreaking havoc on children's, sort of mental well-being. But then the question, of course, is like what to do about it. And so one of the things that a lot of people find concerning is the idea that schools are going to take this on, that we're going to, again, add to another thing to this place that's supposed to be about teaching and learning. Well, we're going to now also make them the mental health, sort of caretakers. And certainly on the school-based health center topic, we see that as a major category where they talk about services to children. So as a compassionate person, right, would be like, oh, this is great. We need this. We agree there's a crisis. But as we peel back the layers, there are, again, reasons to think that perhaps a school is not the best place for children to get their mental health care. So my question, Rhyen, for you is, with all of this sort of deep dive into the mental health of kids happening in schools, is there any evidence that it is working?
Well, Erika, and I will tell you, there is some evidence coming out. So in 2020, University of Arkansas did an extensive report. They investigated 24 schools across their state that had implemented school-based health centers, and they evaluated them for improvements. And one of the things let me back up a step and say that one of the selling points to this is it improves academic performance, and it improves student attendance rates by these students who seem to be skipping out on school. And what University of Arkansas found was that there was no statistical improvement in academics, and there was no improvement in student attendance. There was also a 2023 report done that shared the same basic data that said that they didn't see any improvement in academics. The positive they found was that there was an increase in diagnosis of mental health issues amongst their students. So when we talk about mental health and so forth, it seems that the mental health issues are on the rise amongst these students, yet we see more and more students gaining access to mental health services within the schools, yet the academics and the attendance, which are selling points, are not improving.
Dr. Mendoza, any additional thoughts on that subject?
Yeah, I just want to make sure I heard Rhyen. Did you say they concluded it was positive that more kids had diagnoses? Did I?
Yeah, the 2023 report said that they did find a positive, or they found a positive increase in diagnoses of students with mental health issues.
Which, of course, is actually negative. Didn't you know why I'm saying that? Because, I mean, I would point towards Abigail Schreier's new book, Bad Therapy. I think she lays it out pretty well. And I think, John Haidt's work, whether it's Coddling of the American Mind or his new book, The Anxious Generation. I mean, I see from my standpoint, again, practicing emergency medicine and in the ER for over 20 years, where, in the United States, severe mental health issues come through the ER, right? Like someone might be in a therapist's office, and if they say, I'm going to commit suicide, or if they are in the counselor's office at school, they get sent to the ER. So, I mean, I've seen the whole rise of things with the younger generation. But, I think that the expansion of the DSM diagnoses, I think the overprescribing of pills to kids, which a lot of the pills that aren't even FDA approved for youngsters, the combination of different pills. I just think that, to me, I think the schools respond kind of in the way they do, like, oh, we're doing terribly academically, let's focus on all this other stuff. It is just not, it just doesn't comport with reality. So I think the more they focus on this rather than focusing on school, and just if you're constantly having kids think about their emotions all the time, I think it really has the reverse effect. I think getting back to the basics, stopping with, the critical race theory, shaming on skin color, all these other things we know, putting back athletics and recess, all these things. I actually think that's where the focus is. I don't think it's a win if you're coming out having more kids with more diagnoses that because it gets attached to pills. That's what with the gender issue. It's not like you're saying, oh, hey, we're talking about this. It's like a concept, an idea. It's a pathway that gets attached to medical interventions. And so I think that if we all step back and think like that, it's like, I say, it's like, I worked before the opioid crisis really got going at the peak and sort of the decline. It's never really totally gone away. But think if we said in schools, we don't want later people will suffer with pain. Let's identify the kids now so they won't suffer later. Let's do the pain scale every day in school, starting in kindergarten. What's your pain level? 0 to 10. Every class we'll ask it. Reading, math. Well, don't you think kids would start focusing on every little thing hurting? And then if it got a school-based health center started passing out, like stronger meds. And I mean, to me, it's really the same thing. And then the last thing I'll just say is I do think the technology, the cell phones and social media is a huge influence. And I think, again, Jonathan Haidt's work with calling for like phone-free schools, which some states have passed, I think in Florida and in Utah to some degree. And then like phone-free Fridays. I think different things like that to me would be more appropriate for schools to start exploring rather than giving kids additional diagnoses. That is just so wrong to me.
I suspect that for them, it's a positive because it sort of justifies the existence of what they're doing, right? Like, see, we told you there was a bad problem. And now look, we found all these really bad problems. So look at us. We're so important. So I see it as a negative as well. But I think when you're trying to justify what you're doing, you feel like if you can just identify everybody has a problem, everybody needs us to get involved in their mental health care. A follow-up for you, Dr. Mendoza. Yeah. So what role does parental engagement in schools have, in students' mental health?
I think that, so in general, I mean, I think it's really, a positive. I think, if you're kids see you at school, if we're talking at that level, but also, parents who, are on committees or run for school board, all of those things. I think, part of why I've gotten involved in advocacy outside of my practice of medicine is because, I want my kids to see me trying to constructively solve problems instead of just, diagnosing that, there are so many problems. So I do think that, that is, I think, a positive.
And in terms of action items, we always try to leave parents with like something that they can do. And so I guess like when you're thinking about and you've named a few things, obviously, which is the involvement, but are there things that come to mind that you think of as like action items for parents as they learn more about this concept of school-based health centers and there's just this overall mission creep that we're seeing in K-12?
Yeah, I think, get educated on the issue, which you all do such a fantastic job through this and all your resources, because I think it can be very overwhelming and you can feel like you have no control. I think in the medical realm, understand that in many, many states at age 12, there's sort of a carve out in terms of, parental consent. And now with computerized health records, they're, in a way, it's like when that you can be proactive about signing the consent form. So you have full access to your child's records starting at age 12. You actually have to ask your child for access starting at 12 for the complete record. But I think if you know that information, you can get that access and you can understand if this is kind of creeping into the schools, that they may not be fully up to speed on the level of, consent and understand you can have as a parent. You have to be proactive about going out and getting it, and you shouldn't, feel bad or awkward about it. It's the law, but you have to know how to, go after some of these things about access and consent and understanding what's going on with your school.
Hey, and Rhyen, anything else that comes to mind in terms of what parents can do?
Yeah, I mean, certainly start with our reports. We have that report on the school-based health centers, and then linked in there and also available is a list of your school districts that we've currently found them using school-based health centers. What we encourage parents to do is to kind of read through that and look at the list, and then go back and look at their school district. There's also a list of questions that parents can ask their school district about, what their students have access to, what services are there, and then communicate with us if you have questions. If you found stuff at your school but you're not entirely sure what it is, please drop us an email, and then we'll investigate, follow up, make a connection with you, and help you through that process as you try to navigate what's going on in your district.
All right, and to both of you, is there anything that I did not ask that you really would like to comment on, that you think is really important? Anything that we didn't talk about that you feel like needs to be part of this conversation?
No, I mean, I think you really touched on all the points. I think I just would add that, as you guys always do, is paying attention to, school board races and other leadership roles in your school system, and understanding that this medicalization in school is something that is creeping in more so in other places. And so you should be asking about that as well when you're looking at your school board candidates.
Anything else, Rhyen?
No, I just, don't let this stuff scare you. I think, I've worked inside of schools, so, most of the time the people there generally care about your child and so forth. And, you just have to do your due diligence as a parent and investigate what's going on. And, having done the research on this, a lot of these school-based health centers I've looked at just typically offer the standard care stuff. And you can still not be for that. I totally understand that. But just know that it is actually a little bit more rare, depending on your state, as to whether they offer the abortion care or emergency contraception or even gender affirming care. That's fairly rare at this moment. And that's where the proactive piece comes in, getting, as Dr. Mendoza said, get involved in the school board to make sure that those pieces of these things do not filter in.
Yeah, I think that's a really good point too, is number one, don't listen to our conversation and freak out. Again, do we see trends that are concerning? Yes. But in some ways, like, that's the perfect time, right? Because now it's like, if you like the idea of the sports physical or the quick swab for strep or some, the hearing test, the eye exam, that makes sense. But just be aware, again, that as everything becomes hyper politicized in our world at the moment, and as activists have sort of like made their way into positions of power, we are seeing concerning trends. And so this is a good chance to get out in front of it. And so, if you may have a school-based health center, you may be a big advocate for them. Just know, what do they do? What don't they do? And are there plans in the works? Because that would be my main thing, right? Is just to be able to put the brakes on some of this bad stuff, this inappropriate stuff, this stuff that drives a wedge between parent and child. And these things that can have, again, can do, to quote Abigail Stryer, irreversible damage, and make sure that what's happening in those health centers, makes sense and is actually helping the people that are really in need. Okay, so I guess that's it. If nobody has anything else, I want to thank you so much, Carrie, Doctor, for being here with us. and, sharing your knowledge, your expertise. And also, Rhyen, thank you so much for all you've done in creating this report, doing the research, and then helping to break it down for people. I am very grateful for your due diligence and your ability to stay focused on a task such as research, which I am not as good at. And we hope this conversation has been helpful. If you have any questions or concerns that are, generic or even about what's happening where you are, please don't hesitate to reach out. Rhyen has his Twitter handle up there. I have mine up there. Dr. Mendoza has hers up there. And also, I did want to give you, Dr. Mendoza, a chance to just tell our audience a little bit about the organization that you now run, so that if their concerns are more around the issues of gender, that they know about the resources that you guys provide.
Oh, thanks. Well, again, I just want to thank you guys for your excellent, amazing work. I look over at your resources all the time. But with my advocacy, I'm over at Genspect, which is genspect.org. It's an international organization founded in Ireland by Stella O'Malley. But we've got, folks directing things in all different countries. I'm in charge of the US. And so again, go to genspect.org because we have a lot of resources there too, related to schools, related to support groups. And we're planning more and more things. We've got a conference coming up in Portugal, and we do one in the United States as well. We've got something coming up for Rapid Onset Gender Dysphoria Awareness Day in August. So more to come on that. But yeah, just go to our website and you can find me on Twitter there. Also Genspect's Twitter handle. And you can email me at carrie@genspect.org. I'm happy to, help answer questions related to our work, but just wanted to thank Parents Defending Education for their amazing, amazing work that you do and having me come on. Thank you.
No, thanks for being with us. So again, please check out our school-based health centers report. It's at defendinged.org. You can see the link on the screen now. And also consider sharing it with other parents as well as, your local school officials and school boards. I think for many of them, this is also very new information. And lastly, we just say, try to be as aware as you can of what your kids are being exposed to in school or what direction your schools may be moving in. Reach out to us if you need anything, share the video, tag a friend. And again, thank you so much, Dr. Mendoza, and thank you so much, Rhyen, for being with us. And with that, we will see you next time at PDE TV. Take care, everybody.